So let's start. Like you said, my name is Brad Scoggin. I am one of the founders and the CEO of ArborXR. And we have got a really cool talk today. Chris and Mynd Immersive have a pretty powerful use case. They're doing it at scale. And so I think it's going to be fun to hear about what they're doing. I do want to start with these awesome slides and tell you a little bit about ArborXR. Kelly, are we close? Okay. Well, I'm going to start without the slides then. So Arbor is an MDM for XR. And so a lot of the companies we work with use something like Intune or VMware to manage cell phones and tablets. And when it comes to XR, those just don't work. And so we built ArborXR as device management for XR. And we do kind of three key things. So we help you manage the device itself. Where is it located? What's the health of the device? Remote wipe. And a really interesting stat is that over almost 80% of the companies we work with that are doing larger deployments use devices from more than one hardware company. It's a very interesting stat. And so it's important. There's a lot of hardware companies coming out with kind of light management solutions, and those are not device agnostic. So a lot of our customers are using AR headsets, VR headsets, so having a mix and having a solution that can manage all those is important. Oh, there we go. Well, see, there we are. There we go. Is this on? Boom. Now you can see, right? There's all the stats we know about the power of the visual going with what I say. So the second thing that we do is we help install and manage content. So we all know content is, we all know content is king. That's especially true in XR. We're all doing training. Oh, let me go back. And so one of the things that, so managing the content, distributing the content, one of the things we launched, this is not the right version, I guess. I missed it. All right, we're just gonna sit here. One of the things that we launched about a year ago is a content directory. So we've got the largest directory of XR enterprise content creators, about 200 that we work closely with, that we have vetted. So whatever use case you may have, we've got a team of specialists that can connect you with multiple different ISVs who could create the content for you. And then the last thing that we do is we manage what happens inside the headset. So you don't want your patients or your employees getting lost in settings, menus, or games, so you can lock it down to just the content that you want them in. And then I'm just sad about my slides, sorry, but we'll be all right. Last thing I'll say is, and we'll transition to Chris, because he's the star here and doing some really powerful stuff. We've been in XR for about 8 years, and I usually insert some sort of joke about, dog years, XR years. 8 years is a long time. Has anyone been doing it longer around that? Like, it's a long time, right? You feel like we've been in this forever, it's a slog. But it's given us a very unique perspective. We work with over almost 2,500 companies in 90 countries. We have a pretty big footprint in education, work with a lot of the top universities. But kind of our bread and butter would be like the Fortune 500, Global 2000. We work with almost 100 companies there. And so doing that has given us, I think, a pretty unique perspective. And so we love doing talks like this and bringing partners like Chris, because Chris is going to give some real data. I think, in 8 years or longer, we've been at a lot of conferences. And unfortunately, I think a lot of talks are kind of the same thing with a different coat of paint. And so we try to bring some real actionable data, which is what we're going to get from Chris today. And we did start about a year ago. We started a podcast. And every time I say that, I feel embarrassed almost, because I think podcasts are very markety. But Chris has been on the podcast. We just interviewed Delta last week. We've done about 30 different interviews. And if you're actually deploying XR, I think it's pretty powerful. We've got a lot of our customers and partners that have come on, and we'll really walk you through what their process has been, what the pitfalls have been. And so that's called the XR Industry Leaders Podcast. There's an awesome slide somewhere out in the world. All right, now we're going to get to Chris. Why we came here. I got my plug in. So Chris, I was going to ask you, how long have you been CEO? And
so we started 8 years ago.
Okay, so 8 years. Okay, there we go. I forgot. Yeah, that we connected on the podcast, 8 years. So we're the same age, same XR age, but over 10,000 seniors and caretakers. It's pretty impressive. Multiple countries: U.S., Canada, Australia, the UK. This stat I think is really powerful too. First virtual reality solution to be offered as a supplemental benefit on a Medicare Advantage plan. I love stats like that. Feels like we're getting some oomph behind it. Yeah, I think it's a round of applause. I think it's very impressive. Largest network for veteran care. And you see some of these stats on the Stanford study. I will not read those because that's where I want to start with you, Chris. I know you just completed a very cool study with Stanford. So maybe kind of walk us through what was the setup for that and talk through some of those results.
Sure. Can everybody hear me okay?
Oh, you have a mic. Do you want a mic? I have a mic for you. There you go.
Okay, thanks, Brad. Thanks for that nice introduction. Yeah, Stanford, so we completed a 2-year study with Stanford led by Dr. Jeremy Bailenson, which is on one of your slides. He's a really great guy. He came to us and said, would you guys be open to doing a sort of landmark study where VR intersects with aging? And we said, sure. So 2 years later, 17 senior communities in size of about 250 plus a large in size of caregivers participated in this. So we got some great results. And, you know, not 1 or 2 or 3 out of 10 seniors said they felt more positive when they used Mind, but 8 out of 10. Right? I mean, that's phenomenal when you start to think about the adoption of this technology with this particular generation. That's really phenomenal data to back up what we saw 8 years ago, but had a hard time telling our strategy and vision of seniors in VR to a lot of people. It was kind of a weird stepchild. But the thing I think we're most excited about on this study was Jeremy is the data that has come back around the impact with caregivers and their relationship with these older adults. 95% of the caregivers said this was beneficial to their relationship.
That's powerful. And you see the other stats. 79% say they felt more positive. 58% reported feeling less isolated. So I have a question that we didn't prep on. I think we did talk on the pod. But I think, again, being in XR for 8 years, I've had to raise money over the last 8 years. Probably a lot of us have. And I think we're always looking for those real hard ROI stats. And I think to be cynical for a minute, when I look at this type of stats, these feel soft. You know, I felt better. Yep. You know, we connected more. I was more engaged. And not that those are unimportant. I mean, you're having tremendous scale. So maybe talk about how you take those kind of soft results and then put them into actually growing the business and reaching more people.
Yeah, great. Great question, Brad. Yeah, so I think what we've learned over this 8 years is that XR is good for a lot of things in senior care. We have an exploding population of older adults. Not too many people know this, but 10,000 people a day are turning 65 in this country alone. So in 8 years from now, we will have more people 65 than people 18 or younger. This is a huge demographic shift that a lot of people in Silicon Valley certainly haven't got their head around. I left Silicon Valley actually to start this company in Dallas, Texas, and it seems like this sort of heartland of the U.S. has been very ripe for this opportunity. When we think about ROI and we think about the data and we think about our product and where it fits in to solve problems in senior care, we think about the engagement side of things with memory care, assisted living, giving these people a way to remove the 4 walls and move into what we call the 5th quadrant, where we connect their consciousness with memories, with amazing content that can open new neural pathways. We see it all the time. So that's one aspect. The second aspect is functional therapy. So we're in a very big deal with Select Rehabilitation out of Chicago. They're the largest contract therapy across occupational, physical, and speech and language therapy. Well, this is really exciting because they have 22,000 therapists, and now we're moving the first order into 500 new communities to give these therapists those tools. So it's very, very exciting coordinates on functional therapy. We also have our first CPT codes established by the American Medical Association to study VR therapy. So that's parallel tracking while we're building a nice commercial business. Third angle that we see a lot of value in XR in this particular area is, no surprise, but it's caregiver training and caregiver wellness. These people need a break. I mean, this is a hard job. And they also need the tools and the skills. So we've created simulated environments, what it's like to care for somebody with dementia. We throw curveballs at people. We throw the most bizarre assault sort of situations at these folks because that's what they're going to experience on the floor with dementia.
That's good. And by the way, earlier in my career, I thought I was proud to be raising money. The longer you get in your career, the more money you're raising. You're thinking maybe that's not a good sign, right? You need to have some traction. But Chris, Mynd Immersive helps facilitate VR in several areas: managing pain, improving mood, engagement, increasing short-term and long-term memory. Maybe do you have a story or a use case you could share with us that highlights some of those benefits?
Yeah, I think one of the more fascinating angles to this technology is the ability for it to unlock these neural pathways, especially with dementia or Alzheimer's patients. I think I might have talked about this on our podcast, but it was a really moving situation, sort of one of those moments that just says, you're in the right track here, Chris. You're doing the right thing in life with this business and with what the impact is making. but I was in New Jersey at a home with a couple that had been married for 50 years. He was perfectly healthy. She had late stage Alzheimer's. And I was in a room with about 9 clinicians, and we were doing this couple as a pilot. And I asked him, I said, well, where's a place that you guys visited, during your 50-year marriage that was special? And he said, Paris. And then she didn't really confirm that. She didn't know his name. She didn't know my name, certainly, and didn't know what she had for breakfast. But I asked her, I said, and I handed this pair of HTC glasses that are really, really small. They're not a big strap on head, which we've worked with HTC now for 2.5 years, pioneering a new level of ergonomics for senior care and VR. Having said that, I gave her the glasses. I said, would you like to go to Paris? And she said, yeah, I'd love to. Okay, so I put it on very gently, and she, within 30 seconds, was saying, there's the Louvre, there's a tower, honey, we went to the tower. And she started talking about the names of her kids. And then she took it off after a minute, one minute, and put it aside, and she was fully present with him for the next 10 minutes that I was there. Anyhow, I don't know how long it lasted after that. But we know XR has longevity beyond just the actual use case, and we're seeing that in pain reduction. We're seeing that in anxiety. A lot of things we're doing with Ann at the VA right now is just really exciting. Great job last week, Ann, at the VA summit. But their study is looking at Mynd in 9 different communities in Pennsylvania, and pretty big in size. I think it's over 200 now, showing a significant reduction in pain through distraction, reduction in anxiety, all on clinical scales. Now, this isn't a true clinical, placebo A/B clinical test, but this is very good data to start informing where our product needs to go and what additional research we do need to do. But the research is we're very much a research-backed company here, and it's very much a focus. But I'd say that's probably a story that has kind of kept me motivated through this whole process.
I love stories like that. I think it's so important. And probably in the healthcare space, you get to experience it more than maybe some of the other verticals. But everyone in this room is pushing, a rock up a hill with XR in a lot of ways. And so it's fun to remember, okay, that's why we do it. I mean, stuff like that. Okay, Chris, let's talk about some of the challenges. So maybe there's some CEOs or entrepreneurs in the room. At the very least, there are XR champions, so it's a similar thing. You're starting something in your organization. And so maybe walk us through what your process has been and some of the challenges that you've encountered getting started and going to scale.
Yeah. I don't know if we have enough time.
You have 9 minutes. And actually, have 4 minutes.
Yeah. No, I'll try to make it quick. I can say this. We started in 2000.
What caused you the most tears in the last 8 years?
This is. I'm so happy to see Samsung on the main stage coming back into the market, but it's like we launched this business with Samsung Galaxy 7 phones and a slip-in headsets, if anybody remembers those, in 2016, 17. And we actually got those out into 20 different states and tried to support this with nurses when these things were falling out and trying to charge the phones and getting content. It was just a disaster. But we actually grew the business. We got into 20 states with that product and just kept iterating. We just kept pushing the dial because we knew there would be another generation right behind that. So we were the first U.S. healthcare XR healthcare company in the U.S. to bring Pico in. When I saw those guys in 2019, I'm like, this is exactly what we need. So we did a deal with Pico then, and that was very fruitful for us for about two years or so. And then we moved over to HTC Vive and have created a really, really healthy strategic partnership with Cher and with Dan O'Brien and that whole team. So we're excited about that part of the evolution of the headsets, because now we're issuing in a headset that is 189 grams. Grandma thinks about these as glasses, not as goggles. And that's really important for our market. On the back end side of things, which pertains to all the wonderful partnership that we do with Brad and his team, we couldn't deploy this network into hundreds and hundreds, and now we're really close to hitting the 1,000 mark on communities where we have to manage those devices, both care tablets and XR devices. And those two devices talk to each other, and they have to talk to our cloud. And so we have to push content, we have to push updates, and Arbor does a wonderful job of helping us manage that. And it's really been a benefit to our relationship that Arbor's got all these tools to help us manage all those devices in the field, whether there's some legacy on Pico or all the new changes with HT that come through. It's a really powerful partnership.
That's good. Thank you for that, Chris. Appreciate it. And what we've seen time and again is it's groups like Ann and her team, or Chris and his team, and probably most of the people in this room. You're pushing. It's the commitment to it, and then it's finding those little wins. Right? We've got to have the little wins to show leadership, to show investors, or whoever it may be, to get to the next checkpoint. Chris, with 8 years of experience in, like, you've walked through multiple, you've gone through different hardware iterations. I'm sure you've gone through different content iterations, and you're at scale. You're one of the handful of people in the world that are at scale. Maybe share some advice. What advice would you give to others who are thinking about getting started at a pilot stage or even going to scale, in healthcare specifically?
In healthcare. Good question. I mean, I think there's a lot of content opportunities for XR developers, and I don't think XR developers necessarily think about digital medicine and the future of digital medicine as much as they might want to. But we're moving fast towards the regulatory engines are waking up and they're speeding up, which is a really good thing for the XR community. What we're doing at Mynd is we're building a huge install base of highly functional 6DoF Gen 2 Qualcomm chipsets into the HTC headsets and putting these out into hundreds and soon to be thousands of locations. And with that, we have an opportunity to push content that we don't create, obviously. So we have a lot of third-party relationships, and we're always seeking more third-party relationships for folks that really want to get serious about meaningful XR content. Because this tool, when I first saw this, I had a good friend that was acquired by the Facebook team that was part of Oculus down here in Orange County, and then moved to Menlo Park across the street from my office when I was in San Francisco. And I saw the under the hood of what Oculus is doing, and I just saw immediately that this was going to have way, way bigger benefits to society than teenage gaming.
Thankfully. No, we used to be in entertainment, actually. So I always say having fun isn't unimportant, but there are more powerful use cases. And you know what? A lot of people get a VR headset for the first time because they're having fun. So it's not important. Before we may have time for a little Q&A, but before we go there, you've seen a lot. We saw the history right before this. So from your perspective, and as things are speeding up, you start seeing accreditation from some of these outside orgs, which feels very powerful. I mean, what does VR in healthcare look like over the next 5, 10, 15 years?
Yeah, I mean, there's a really bright future for this technology. I think it's going to sweep into the senior care area really fast because it partnered with AI and all the developments that we're doing on the back end there. But when you look at just the growth population of older adults skyrocketing and the caregiver population is actually declining. So we think that immersive and AI, smart tools, assisted tools will help solve that gap, not displace any workers by any stretch. So I think that's a big future, is this kind of convergence of AI and XR. I think when you look at studies that we've done, other studies we haven't talked about, or clinical data that's coming into us, we've done CMS funded a 35 community location test with us in Indiana, my home state. And what that, over the last year, we've had an N size of over 1,000. And 9 out of 10, not 1, 2, or 3 out of 10, but 9 out of 10 of these older adults in retirement homes said they would recommend Mynd to their friends. So we're seeing an NPS score now that is just off the charts. So adoptability has been something we've had to get over the hurdle, and we still have to. But this generation has they've adopted color TV, FM radio, the internet, PCs, social media, fastest growing segment, social media. Well, guess what? They're ready to adopt this technology. We just have to make it easy, and that's what Mynd is all about: is making XR easy for this huge population.
Yeah, that's good. I think it's interesting too in healthcare specifically. I think the first time I talked to Ann, I talked to Ann before I talked to you, and she said, I don't know if she said cured, but we've cured phantom pain. We've reduced opioid usage. I mean, that's insane. Right? I mean, that's super powerful. And so you've got use cases that are medicine or therapy. But then you've got the training aspect. I mean, several of our customers are training nurses, and so you get the cost of getting clinic time versus putting on a headset in your living room and going through it, as much as you want. I think it's a very bright future. We got about 3 minutes left. If anybody has a question for Chris, yes, I'll run the mic to you.
Thank you. So the cost of care is so important in healthcare, and there's a big push to reduce costs and with very limited dollars. So how are you building the case or showing the dollar impact that your solution is having to these healthcare organizations to actually adopt and implement the solution?
Yeah, a couple of different ways in terms of how we approach senior living, the commercial world of senior living. They're all sort of competing for having the best tools in their communities so they can draw families. So we get drawn in on all kinds of new deals because if they get one new customer at the senior community, that pays for the Mind service for the year, for the entire community. So that's one angle, and we try to keep the cost as low as we can on this so it is affordable and adoptable in the early stages here. Secondly, we will see a stream of reimbursable therapeutics that will be coming down our pipeline. That will be an ROI that we will probably share with the facilities to some extent. There'll be some interesting deals that come out of that. And then the third is training. So when you just think about the churn that exists in senior care, it's very high. It's a big problem. So whenever I go into C-suites, I always talk about training, and they said, well, if you can reduce, if I can have one less person leave the job, that's a $4,000 savings, right? So the more that they can get their staff confident in the skills that they need to succeed, that's a huge ROI on the CFO side of things when it comes to HR. Yeah.
So
60 seconds. Sorry, gotta go fast.
Yeah.
Medicare and insurance companies, often, particularly with the senior care, the insurance companies are going to say, you show me that this can help reduce hospital visits or less medication or whatever it may be. Medicare might say, you know, I'm not going to do the test, you do the test. How do we get by that quandrum to get the data that's needed to show the insurance companies and Medicare that this is worth it more than they're doing today?
Right. Well, that's the multi-billion-dollar question that has sort of disintegrated a lot of the early phase 1 digital therapeutic companies that base their entire business on prescription therapeutics. Getting FDA approval, hundreds of millions of dollars spent on doing that. Now who's going to cover it? And the commercial side of the business has not been addressed as much. What we've tried to do at Mind over the last 8 years is not bet the farm on an FDA approval for a specific indication. Rather, build a commercial OTC business that we know can help reduce some of the main pain points in senior care. And along the way, studying those with every partner that we possibly can from universities all over the country. Stanford is one, but then the CMS study I referenced is another one. CMS funded this, and we are now in phase 2 of that. I can't really share all that data right now, but it's digging into the clinical aspects of pain medication reduction. That is a key indicator, and it's also looking at anxiety reduction. And you know, these enterprises that we serve are trying to rid themselves of overuse of antipsychotics and opioids. XR is really well positioned to help with that.
Awesome. Well, thank you for coming. If you've got more questions, come by our booth. We'd love to talk to you about deploying XR or your content needs. Give it up for Chris.
Thanks, Brad.